Hi, my name is Jake. I'm currently a physical therapist at the Foothills North Mesa location. Today we're going to talk a little bit about concussion prevention as well as the rehab process associated with one of our current patients. Generally speaking, with a concussion, it's called a concussion, but it's actually a relatively mild brain injury, right? Oftentimes it doesn't show up on MRI or CT, any other imaging, but there is still in fact a brain injury that has occurred. General signs and symptoms that can occur with concussion are pretty variable. Common ones being headache. You can have head and neck pain, you don't have to. Difficulty with attention, changes in emotional responses, difficulty focusing in class for youth students. You can also have other types of things that are more severe as far as nausea, vomiting, double vision. There's a wide gamut of different symptoms, so talk with your doctor to confirm whether or not you have a concussion. So one of the signs and symptoms associated with concussion can be new onset or latent onset dizziness or vertigo. What can happen is essentially there can be a mismatch associated with the mild brain injury with regard to visual input or even your vestibular system or your inner ear. Talk with your physical therapist regarding vestibular rehab for treatment to address the ongoing dizziness that may or may not occur. With regard to Bailey specifically, when she first came in, she was experiencing a wide variety of different types of symptoms associated with concussion. She had some different emotional responses associated, difficulty with attention. She was experiencing some vertigo and some dizziness associated with higher level activities. She also had more or less a cardiovascular component to what she was feeling as well. When she got above a certain level of cardiovascular output, meaning working at a certain level, she'd experienced some dizziness and some headache. So a lot of her rehab was associated with improving strength and conditioning, improving cardiovascular rehab, and also facilitating increased vestibular system recruitment, all together in conjunction to kind of get her back to being able to play soccer at a high level, high cardiovascular output, high strength output without residual symptoms. If you're worried if you have sustained a concussion or more concerned with concussion prevention, give us a call. I'm Jake, Foothills North Mesa. Come on over, let's chat about coming up with a plan of action best for you.